I'm here with Nick Knowlton, who's the Vice President of Business Development for Brightree. We're talking about ePrescribe and healthcare interoperability, and this is a huge development. It's something that's been happening in healthcare for a while, but it's now making its way to HME, and that's a good thing. This is overall a very positive development, right?
Yeah, I'd agree. I mean, for years our industry was kind of left behind for how the nation has viewed the healthcare information technology and interoperability roadmap. And we finally feel that we're in a position as an industry where we can help providers get connected to their referral sources to make sure that they can get the right information in place with patient intake so that they know what they need to do to take care of the patient, and they know that they're going to be able to obtain reimbursement. And that both, ordering data, demographic information on patients, as well as, all the documentation that's very specific to our industry.
Obviously, documentation is a key concern for HME providers, and it's something that ePrescribe can really help. Why don't you tell me a bit about that?
Yeah, so we're at a peculiar spot in the healthcare industry. I hear from customers all the time stats like we're 3% of our health system spend, but we're 30% of the documentation burden on referring providers. And of course, while there's the financial, incentive for our providers to have complete documentation, the referral sources are the ones that have to fill it out, and there's really no incentive in place for them to do it. So the whole ePrescribe revolution is about making it easy. It's about giving providers options to connect with their referral sources to, obtain better documentation, to allow for the back and forth that naturally occurs, when a patient is referred to an HME provider.
And that's going to, speaking of referrals, this has to be a huge differentiator for providers.
It does. If you think about what a physician in a physician practice setting does, they follow their process for reviewing systems, making observations, assessing the patient, and making a plan. Well, very typically within their EHR, there's workflows for, I need to ePrescribe medications. In fact, it's mandated that if you call yourself a certified EHR vendor, that you support that. And if you're one of the physicians or health systems that has obtained the EHR incentive dollars for meaningful use in other programs, that means that you actually use that at the point of care. Well, nobody ever thought to say, wow, HME really needs this too.
Yeah.
A lot of the EHRs out there, they have the workflows built into them. And the best way to keep a physician's attention is do not distract them. Or if you have to distract them because we have very peculiar documentation requirements in HME, make sure that it aligns with their native workflow as best as possible. As ePrescribe solutions are only as good as the other end of the connection, right?
Right.
If referring providers don't adopt or they don't retain adoption, then it's not as helpful to our providers.
So how does a provider get started with ePrescribe?
That's a great question. So we think that this is going to be the year of ePrescribe. There's enough technology. There's enough understanding at the federal level of the disconnect that CMS and others have created, that they're now supportive of what we're trying to do as an industry to make sure that our providers can be lifted up to the same level of data parity as medication prescriptions are today.
Yeah.
So for somebody that wants to get moving, get started, number one, I'd say talk to your IT vendors. Interoperability is not just ones and zeros. We have the footprint and the investment here at Brightree to be able to say, we can go talk to CMS face to face and say, gosh, here's the problems that exist out there, and here's what we can do together to solve them. CMS has been very receptive to that. So my biggest recommendation for folks is get engaged. There's ample systems out there, there's ample technology, and we stand ready to assist any of our providers that want to engage and move forward.